let's talk about something that so many people deal with, that nagging, persistent shoulder pain that just will not quit. But what if there was a completely modern, minimally invasive way to tackle it? One that goes right to the source of the pain. Well, today we're diving into exactly that.
Okay, so before we jump into the solution, let's just get real about the problem. Because if you're watching this, you know it's not just a small ache. It's about how this kind of pain can totally hijack your daily life. I mean, seriously, does this sound familiar? That sharp little jab of pain when you reach across for your seatbelt, or that involuntary wince when you're just trying to put on a coat? If you're nodding along right now, you get it. You know exactly what I'm talking about.
And yep, here they are, the usual suspects. That constant deep ache that seems to get so much worse at night, totally wrecking your sleep. The stiffness that makes a simple task like grabbing something off a high shelf feel like climbing a mountain. And the sheer frustration when you've tried other things and you're just not getting anywhere. If this is your life, believe me, you are not alone.
So, what have you tried so far? For most people, the journey to find some real relief follows a pretty familiar road, one that's often full of temporary fixes and appointments that can feel like a revolving door.
This is the classic playbook, right? You start with physical therapy. You do the home exercises. When that doesn't quite cut it, you move on to anti-inflammatory pills. Then come the cortisone shots, maybe even something like a hydrodilatation procedure. And way down at the end of that road, there's always the option of a big surgery.
And this, right here, this just hits the nail on the head. That cortisone shot feels like a miracle for a little while, but then the pain creeps back in, and you feel like you're right back at square one, just waiting for the next appointment. It's a really frustrating cycle of hope and then disappointment.
And this is the dilemma so many people face. You're stuck, right? On one side, you have these treatments that just don't last. And on the other, you've got a major surgery that you really, really want to avoid if you can. It's no wonder people are looking for a door number 3.
And this is where the story gets really interesting. This is where we talk about that door number 3. What if, instead of just chasing the symptoms and putting out fires, we could actually go after the root cause of the inflammation itself?
So, what is actually going on in there? Well, in a lot of these chronic shoulder conditions, like frozen shoulder or rotator cuff issues, the body actually grows these tiny abnormal blood vessels. The best way to think about it is like this. These little vessels are like fuel lines, and they're constantly pouring gasoline on the fire of your pain and inflammation.
And this is the absolute game changer. A procedure called shoulder embolization doesn't just try to temporarily put out that fire. It goes in and cuts off the fuel lines. It's a totally different way of thinking that aims to shut down the inflammation right at its source. Okay, let's get into the nitty-gritty, because you might be surprised at just how elegant and, well, straightforward this procedure is. We are not talking about big cuts or major surgery here. This is something far, far more precise.
It all starts with a tiny entry point, literally a pinhole, usually in your wrist. From there, a doctor uses live imaging. Think of it like a GPS for your body, to guide a super thin, flexible tube called the catheter. It's about as thick as a piece of spaghetti, right to those problem blood vessels in your shoulder. Then, and this is the really cool part, they release these microscopic particles that just block up those specific vessels. It's like gently turning off a very specific leaky faucet. And that's it. The catheter comes out, and all you're left with is a small bandage on your wrist. No stitches, no big incision. It's a pretty remarkable modern approach.
Now, when you put it side by side like this, wow, the difference in the experience is just night and day. With traditional surgery, you're talking general anesthesia, probably staying in the hospital, a surgical incision, and then a long, long road of rehab. With shoulder embolization, it's light sedation, you go home the very same day, and, get this, no formal surgical rehab. The difference is just huge.
So the all-important question, who is this for? Who is the ideal person to really benefit from this kind of advanced, minimally invasive procedure? Let's take a look.
Well, this could be a fantastic option for you if you have that stubborn chronic pain from something like frozen shoulder or rotator cuff inflammation that just hasn't gotten better with other treatments. It's for people with mild to moderate arthritis. And, maybe most importantly, it's for anyone who is looking at the possibility of major surgery and thinking, man, I really hope there's another way.
All right, the procedure itself sounds pretty incredible, but what about life after? Let's talk about recovery and what it looks like to get you back to the life you actually want to be living.
Now, because this works by calming down inflammation from the inside out, the relief isn't like flipping a light switch. It's more of a gradual ramp up. You go home the same day to rest. Most people are back to their light, normal activities in just a day or two.
And then over the next 1 to 3 weeks, that's when the pain relief really starts to kick in, and it often continues to improve from there. And this just spells out the benefits of the recovery perfectly. It's an outpatient procedure, so you're home in your own bed that night. There's no shoulder sling, no being stuck in one position, no formal grueling surgical rehab. And a really important point, it doesn't burn any bridges. It won't interfere with other options you might need way down the road.
And that's the bottom line, isn't it? The whole goal isn't just a little less pain, it's to get back to a place where you can go through your entire day, reaching, lifting, getting dressed, without even thinking about your shoulder. That's the real win.
So I'll just leave you with this thought. Just imagine it for a second. What would it actually feel like to sleep all the way through the night without that ache waking you up? To put on your jacket without even a second thought? It's pretty amazing to think that for many people, a procedure that starts with a tiny pinhole is what's providing that kind of freedom. That is a really powerful thing to think about.